Sometimes, when egg and sperm meet, it is not a meet-cute. This is Insomniac Anatomy Academy, where I have insomnia and I study anatomy, episode 205. In theory, an egg and a sperm will meet in the fallopian tube. Then the fertilized egg will implant into the wall of the uterus and a fetus will develop. Poof, done. But sometimes that doesn't work out. An ectopic pregnancy, sometimes called a tubal pregnancy, is when the fertilized egg gets weird ideas and decides to set up shop elsewhere. For a tubal pregnancy, this can mean in the fallopian tube or even in the little fingers at the end of the tube. The fertilized egg can also end up too close to the cervix inside the uterus, or up at the very top of the uterus, or inside the body cavity outside of the uterus entirely, or even very rarely inside the ovary. Ectopic pregnancies occur in 1 out of every 250 pregnancies. These can be deadly. First of all, they can't continue because the placenta is a joint organ between the fetus and the uterus. So without the uterus, the full placenta cannot form. As the cells in the fetus divide, they can rupture the fallopian tubes within the first 8 weeks and cause massive internal bleeding, unaliving both the fetus and the parent. I kept getting comments with people saying that people can have a fetus form in the liver and get delivered. No. There are rare cases of ectopic pregnancy in the liver, and it's rare because, man, that egg was on a journey. But the fetus does not survive, and the parent won't either without medical intervention. So it's vital to know if this occurs. The most frequent way to treat this is with an injection of something called methotrexate, which is also used as a chemotherapy drug and is also an immune suppressant. In this case, methotrexate stops the fetal cells from growing. The body then reabsorbs them. Sometimes, though, doctors do have to go in and fix it surgically.